So I would first say we're not going to settle on a number. We have to constantly look at our public health capacity, just like healthcare systems have to look at their capacity, and looking at specifically what are our needs, not just in contact tracing, but also in surveillance and epidemiology. We have to have data to drive decision making, so we have to make sure we have strong capacity in that area. And we also have to make sure that we're doing a much better job at community outreach and education. So we'll look at all three of those areas, and I won't settle on a specific number of team members as long as we have the pandemic. We'll continue to adjust that based on the needs of our community. At the current time, though, the recommendation that I've made to Mayor Harris is we need to try to get up to approximately 250 individuals that can assist with contact tracing. But I want to make a few comments about contact tracing, because while we have to do the case investigation, identify the contacts, and notify the contacts, isolate and quarantine, we also are looking for barriers that keep people from staying in isolation or quarantine, which is much more case management. For example, we may have an individual who needs housing, so we have to have that team member dedicate the time and resources to get that person housed. So a minimum of 250 currently. We're looking at a variety of different ways to onboard 250 additional team members. With our first COVID response team of 140, those are all Shelby County employees. In addition to that, the city has for some time loaned about and up to 60 employees at any given time. Many of our health department employees were also reassigned to COVID response. So we'll continue to have some employees that are reassigned. We'll continue to have volunteers. We'll continue to have some students. This is a really good experience for medical students, nursing students, and public health students. But we're also looking at potentially working with an agency to have that agency hire individuals who could provide assistance. Lastly, we previously ran 2 shifts every day, a morning shift and an evening shift, because we had such large numbers of cases coming in. We went back to 1 shift a day, 7 days a week, but we will likely get back to 2 shifts again in the near future. That allows us to have some individuals work morning and some evening, but that also would allow us to have some part-time individuals. Your last question was, where does the money come from? At the current time, we really are relying heavily on CARES Act funding, but also within our other programs where people have been reassigned, there may be local funds that have funded those positions or grant funds that have funded those positions. But we'll still have to rely heavily on federal funding at the current time and advocate for additional funds as needed.